Let me talk about one point you brought up I didn't want to skip over. You said that training, in that same study, they said training physicians has a positive outcome. I can't remember the numbers you used. Can you tell us that again?
Yeah, so my favorite part about the study is that if you take these physicians and providers and provide them with communication training, they are 1.62 times likely to have increased patient adherence. So that proves that communication skills and training is essential in your practice. It should be regularly done for
Wow.
your entire team.
So just training them and discussing something as simple as communication. We're not adding in an expensive diagnostic equipment like a X-ray or ultrasound. We're not going through a weekend seminar on how to provide the best rehab or best active care exercises. All we're doing is saying, take your current skill set and let's just deliver it through better words and body language and messaging, and we're going to get better adherence.
Exactly.
Yeah, I mean, you think about it, like some medications, if they could get a 1.62 times response, they'd be over the moon, right? It would be like the
Yeah.
best new medication ever. And here we're saying, yeah, we can get it just by changing the way we act and communicate as physicians.
And my favorite part about this is that it is trainable. So for someone who, knows that they might not be on the upper end of the skill level, it's really good to see this research and know this is something you can make a dent in and totally transform your practice just by adding some new education.
Which, just so it's not intimidating to people, could be just taking a lunch hour on a Wednesday once a month and just talking about words to use. Or something I love is just analogies, like
Yeah.
sometimes we use analogies that are a little too simplistic or they're too complicated for certain patients, or you use an analogy for a while that doesn't work anymore because, maybe the product that you're saying, it's like this. And people are now like, I don't know about that product, like it brings up some bad memories. So I think that's fantastic. 1.62 times improvement, man. That's huge. That's statistically significant, as my college professor would say. Right?
Yes.
Well, any other tips about getting patients to be, adhere to their active care plan or actually do the exercise we know will help them?
I think just remembering that it starts at that first visit right from the get-go. Get your automated messages, establish trust from that very first visit. That way they fully know that you're the provider that they want to have. They're far more
Yeah,
likely to listen to you and follow those recommendations.
I love it. All right. Well, once again, Rebecca, turns out communication matters. If communication matters to you in your office and you want 4 times as many reviews and twice as many referrals, then go check out TrustDrivenCare.com. Thanks, Rebecca.
Thanks, Josh.